There we go. All right. My name is Sarah Florman. I am the outgoing SART project coordinator at the Sexual Violence Justice Institute at the Minnesota Coalition Against Sexual Assault. So I recently accepted a new position within the Minnesota Coalition Against Sexual Assault. So I will be working in the interim with Victoria until we hire a new SART project coordinator for this position.
And hi, everyone. My name is Victoria Riekers. I use she, her pronouns. And like Sarah mentioned, I am in the interim in this position of doing the National SART project work. And so I'm really happy to be here today.
And I don't know if Madison wants to pop on to introduce herself, but we've got Madison Cutler here who is providing tech support today.
Hi, everyone. Madison Cutler. I also use she, her pronouns. I am the Minnesota SART program coordinator at the Sexual Violence Justice Institute at MinCasa. So if you have any questions, feel free to chat or raise your hand and I can interrupt the speakers for you if that's more comfortable than unmuting yourself. But yeah, I'm here to support you however you need.
All right. Okay. So what we're going to talk about today are some a little bit deeper dives into some of the fundamentals of SARTs and particularly starting new SARTs and how to organize your work. So we'll be focusing on how to collaboratively develop key documents such as mission statements and memoranda of understanding, organize and facilitate effective team meetings, and then also identifying some of those target areas for program planning and development. So figuring out what you can be doing with your SART. And first we'll talk a little bit about MinCasa and SVJI. So the Minnesota Coalition Against Sexual Assault is a statewide coalition driving transformative culture change to address sexual violence through advocacy, prevention, racial justice, and systems change. And the Sexual Violence Justice Institute is a project within MinCasa that creates long-term sustainable systems responses to sexual violence that meet the specific needs of each community. MinCasa and SVJI operate on 5 kind of principal values, and those values are collaboration, integrity, courageous and bold action, prevent harm, and social justice. And within SVJI, what we do, so what our role is really to provide training, and that can be in the form of webinars, workshops. We do conference presentations, and sometimes SVJI hosts conferences, sometimes do trainings on special topics for teams across the US. We can provide resources, and that might be in the form of templates, which you'll see a couple of today, fact sheets, blogs, toolkits, and guidebooks. So our website has tons of resources for SART leaders. We provide support for coordinators and team members, and that can look like just brainstorming, problem solving issues that you're having in your current team, helping with issues like meeting facilitation, talking about conflict, kind of just typical troubleshooting. If you sometimes just need some kind of an outside perspective or someone to bounce ideas off of, we are there for that as well. And then we also really think it's important to provide connections for all of you to experts in different subject matter areas, to us and other national technical assistance providers, and to each other, peers who are also learning this stuff too, so that you can be in kind of a co-learning environment, and then mentors. So some SART coordinators or leaders who've been doing this work and have really learned a lot of things that can be shared with all of you.
All right, so today we're going to talk quite a bit about team foundations and facilitation. So what are some of those skills and some of those things that we need to focus on to have a solid foundation for our sexual assault response teams? And so one of the things that's really important when you are leading a team is to have an emphasis on co-creation. right? So SARTs will need to collaboratively develop their processes and practices together. We need to collaborate to find different ways to work together because SARTs are made up of so many different disciplines that have different ideas of what we need to do for the sexual assault response in our community. And so we need to co-create together so that we can all work together and have the best possible response. When we do this, we want to keep in mind that no one discipline should lead or control the development of these processes and practices. Some things that you might want to think about as you go through the co-creation process is what are those power imbalances that might exist on your team, right? So this could look like who holds power in your community when it comes to the sexual violence response. So sometimes we might think about the prosecutor in your community. That person tends to hold a lot of power in the community and in how the community responds to sexual violence. Or maybe there's one discipline that has like 10 different folks coming to the sexual assault response team, and some other disciplines only have 1 or 2 folks coming to the team meetings. And so how is that going to affect the power imbalances on the team? We're also going to want to think about relationships between the team members. Who's coming? Are the relationships newer? Have these relationships been going on for a long time? Are there any historic challenges with those relationships that could present like building blocks, or not building blocks, but roadblocks to the co-creation process, right? And how can we work on deepening those relationships so that we have a really strong co-creation process? And then another thing that we also just recommend doing in general is creating group guidelines on how we want to work together as a team, right? How are we going to interact with each other in a way that folks are going to get along, they're going to be respected, right? All of those things. So coming up with some different statements about how you're going to work together can be really helpful in that process. When we think about co-creation, there's different strategies that are going to work for different teams. So you're going to want to think about the size of your team, the existing relationships on your team, any new relationships that need to be formed when you're thinking about how to facilitate a co-creation process. A couple of the ones that we're familiar with are having facilitated conversations. So having your whole team together and having a facilitated conversation to talk about all the different pieces that you need to co-create. And this could be the SART coordinator facilitating, or if maybe your team's had some different challenges with the relationships, maybe having a third-party external facilitator to help guide this process can be useful. You could also have small group discussions, right, where people break into small groups. Maybe they break up by discipline to talk about different things that you all want to co-create together. And we also want to make sure that we're including all members or representation from all the different members in this process. And then when I am facilitating a co-creation process, I really like to ask at the beginning, what are things that folks need to be able to do this co-creation process together? So what do you need to show up? What are your concerns? And what can you commit to today, right? Because sometimes we know that there's different folks who come to the team. Sometimes there's different relationship dynamics that might affect the team. And so what can we commit to today? How can we make this conversation work today? So some of the things that we may need to co-create together are things like the mission and vision statement for the SART. So the mission statement is really about the purpose of the SART. So a mission, we want to be present focused. We might want to think about the SART's jurisdiction. What area are we covering with our response? We also want to think about who will be served, right? So often we're going to think about victims and survivors. But we also may want to think about what values the SARTs have. So how are we being victim-centered? How are we promoting accountability, collaboration, right? Many different things that could be included there. And so an example mission statement that I have, and this I pulled from our SARTer kit or our starter kit on one of our resources on our website, is the Blank County Sexual Assault Response Team increases access to specialized services and support, and improves the multidisciplinary response for victims of sexual assault, right? So it's very focused on the present and what the team is working toward. Now, the vision statement is where the SART is going. And this is meant to be a bit more inspiring and future focused. So what's that long-term change that the SART wants to accomplish? And that could look like something like the blank county sexual assault response team wants to end sexual violence in our community, or maybe we want to be a model response for the state. Something like that. That's really future driven. And it's really important that we have mission and visions for our teams because this is going to help us reduce conflict because it's going to increase understanding and role clarity. So we all know why we're here, why we are attending this meeting, and what our goals are for these meetings and for this team. It's also going to show to the community what we're working toward, which can also increase community engagement and help us recruit more members for the team. So having this in place can be really helpful. And Madison's dropped in the chat one of our resources. It's the Mission and Vision Builder. And this is a worksheet that you can fill out as a team and work together on to really iron out what your mission and vision builder is. And we're going to talk a little bit more about it in a bit. We also want to think about having memorandums of understanding. And I'm sure many of you are familiar with these. We also call them MOUs, but they are agreements between the different members on the team, right? And they're going to contain things like the history of the team, the history of the relationship, the purpose of the relationship between this member and the team. We also want to think about it, including the role of a particular member agency and what those responsibilities are going to look like, maybe what resources and obligations that team member or that team agency can provide to the team, as well as signatures of decision makers. So some of those leaders at the different organizations involved. And MOUs are pretty important because they can really help encourage collaboration and have that agency leadership commitment, right? Because we know if the agency leadership is not behind the sexual assault response team, it's going to be a lot harder to get the team members to attend because it's just not a priority. So the MOUs can help demonstrate that it's a priority. But of course, we need to keep in mind at the end of the day, an MOU is just a piece of paper and it's not going to replace true collaboration. So the MOU is important to have, but we still need to work toward having regular participation at the meetings each time.
All right, another piece that's really important with SARTs is making sure that there are opportunities for shared leadership. So in order to really emphasize the fact that all of the disciplines participating in the SART are on equal footing, shared leadership can really help improve engagement. It can really help balance out that power, those power differentials, and also just really pays respect to each team member's expertise and knowledge area. So there's a number of ways that shared leadership can be used in teams. You can have, your traditional SART team coordinator. And, traditionally that person facilitates meetings, does logistics for meetings, and is kind of the record keeper as well. There are a lot of options like having rotating facilitators or having co-chairs that are either appointed or elected, yearly or every 6 months. You can have subcommittees on your SART, and we'll talk about those in a second, but folks who are kind of leading efforts within the SART to do specific projects. And then there's also sometimes a fiscal agent. So a lot of times SARTs are funded, as many of you are, by OVW or other grants, stop grants sometimes. And so, the fiscal agent of your SART, the agency that has your funding is often the coordinator, but that's not always the case. So just knowing that all of these different roles are possible, having folks who take minutes and folks who host the meetings, and just kind of paying attention to all of those different opportunities. Subcommittees are both a really valuable place to utilize the shared leadership model, but also a really valuable tool for getting work done in your SARTs, particularly with some of the bigger projects, things like protocol development, or larger scale things like evaluation or needs assessments. It's really helpful to break the work up into subcommittees. And that can look a bunch of different ways. You can have subcommittees that exist only for particular projects, and that are organized around the different responsibilities of that project. You can have subcommittees by discipline that meet maybe consistently alongside of the larger SART. So sometimes we'll see SARTs, particularly in larger communities, that have a law enforcement subcommittee, and they have a colleges and universities subcommittee, and they have a medical response subcommittee, just to make sure that all of those folks are able to connect with each other and be on the same page. And then those subcommittees share what they're doing with the larger team. There are a lot of ways to structure this. It's really up to you and what works best in your community. Yeah, and really, really specific to what it is that your SART is trying to accomplish. One of the things that you want to do in your team really as soon as possible, but if you've got an existing SART and you haven't done it already, there's not a bad time to do this, is to develop shared definitions. So what this means is making sure that everybody on the team is talking about the same thing and understanding each other across disciplines. So there are different words that each discipline uses for different things, right? We have victim, survivor, patient, offender. We have all these different terms that we use, making sure that everybody understands what do I mean when I say this? Phrases like trauma-informed or victim-centered, and understanding and agreeing on what those things are. So when I say that my services are trauma-informed, someone else in that SART will understand what that means, and we'll all agree on how to best provide trauma-informed services. All of these are things, that some of them have what seem like pretty obvious definitions. We can tell you what we think those definitions should be. It's the most important, however, that the folks on your team are in agreement about that, so that when you're talking with each other, that you understand. Next slide. And then another thing that you want to think about with your team, ideally before you reach decision points, is how is your team going to make these decisions? Are you going to be a majority rules team? Are you going to require unanimous agreement? If you have disagreement, who's going to be the final decider? How are we addressing those power differentials in our decision making? Are we making sure that we don't just have folks deferring to people with more positional power? And then also, once the decision gets made, making sure that we have an action step and that we know what it is that we're going to do with that decision, how we're going to share that decision, how we're going to make sure that it's there's a record kept of that decision. So just thinking about, again, what's going to work best for your team, what's going to make the most sense. I think we can always say, ideally, we want to all agree. We want to have a unanimous agreement by the end, but that requires a lot of work and compromise. It's not always going to be possible. So really just, I think, being open to really sitting with that and thinking about, okay, what do we do if we need to move forward, but we can't agree? How are we going to decide how to take that next step? Next slide. And that gets us into another really important piece of SARTs, and that's conflict management. I think conflicts are one of the most important parts of the work of SARTs. I think that a lot of times we avoid conflict because we want to keep things nice. We don't want to offend anybody. We don't want to have an uncomfortable conversation. And that sometimes leads to us avoiding the topics that we know are going to cause conflict. The problem is that those issues are usually the ones that are the most important to the sexual assault response, right? The areas that we don't all agree are going to be the areas where survivors are lost in the shuffle, going to be areas where we're not all responding the same way. So those are going to be the gaps that we need to address the most. And it's really, really important to understand that conflicts, when they're generative, can be really, really helpful. Addressing those conflicts in a constructive way can actually help your team grow, help your team improve their relationships, and it can also help you come to some decisions and solutions that'll make things better for the victims that you're serving. So there's a number of different approaches for conflict management, and some of those will vary based on your team, on the different personalities involved. But a couple of really key pieces to keep in mind are things like making sure that you're recentering folks on the SART's mission. This can be a really good time to bring in that mission statement and remind folks like, okay, this is your opinion and this is my opinion, and this is how, this might be the way that makes my job easier, but what's the best way for the folks we're serving, right? If our mission is to support victim survivors, how are we putting them at the center? How are we remembering to frame this conflict around the mission of this team? What are your current goals as the team? So sometimes these conflicts will come up and they aren't always relevant to the issue that you're addressing right then, or your answer to how to resolve that conflict might be different based on what you're trying to accomplish. You want to really think about repairing relationships, knowing that when conflict happens, there will always be some feelings involved, and making sure that you're doing what you can on all sides as a team to help build up those relationships again. It can be really helpful prior to conflict if you've got a strong team dynamic. If you've got good relationships already built, it makes conflicts a lot easier to withstand. But knowing that there is some work to do in the aftermath and helping to fix that so you don't end up with something that happens to a lot of SARTs, which is those kind of long-standing grudges that are just sort of there, even if on the surface everybody is over it. It really helps with conflicts to listen, to really listen actively to what other folks are saying rather than waiting for your turn to speak. Making sure that you're hearing why folks feel that the way they feel, making sure that you're understanding their reasons. It doesn't mean you have to agree, but it really helps to understand where people are coming from and to see from their lens. Avoiding blaming and judgment. This is not personal. Again, centering on the mission. This is about victim survivors. And then just remembering to be curious. One of the things about SARTs that can be the most rewarding is when people learn about each other's work in ways that they hadn't previously. So a lot of times I think we get really siloed in our roles, and we know our role really well, and we make a lot of assumptions about other people's roles based on what we've seen, what we've heard. We think other people's roles look a certain way. And sometimes we're wrong. And it really helps to know that there is a lot more going on from everybody's point of view than you see on the surface. One example of this that I sometimes use is I had a prosecutor's office. I was working with a SART where a prosecutor's office was really frustrated with the community-based advocacy program because that advocacy program wasn't willing to drive out to a homeless encampment to pick up a victim survivor to bring them in for an interview. And we had to explain, this isn't that they're unwilling to do this. This is that they aren't able to do this. This is not part of their role. This is not how they're funded or structured. This is not, this is not the role of the sexual assault advocate. And just understanding that so that you're better able to not personalize those disagreements. When a sexual assault advocate can't share information, understanding their rules around confidentiality helps you understand that it's not personal. It's not that they're being uncooperative. They really just, this is their role and they have a different focus than you do.
When we're also thinking about the foundations of teams, we want to think about how we're structuring our agenda. I know I've worked with several SARTs over the years who have talked about their meetings are just it's just a meeting. It's just project or program updates, right? And it's a meeting to meet, and people feel like things aren't really getting accomplished. And so some of the ways that we can work on this is changing how we think about our agendas and being really thoughtful in the ways that we're structuring our meetings. So a few things that we like to think about include having a space for team building. So I think a common one that a lot of you have probably participated in before or put on your agendas is having some check-in questions. And these can be a fun way to get to know each other. And we can think of like really creative ones or silly ones, right? Just to kind of start really focusing on those relationships a little bit more. We could also think about having more time set aside for team building if that's something that we really want to be prioritizing as well, so we can go deeper than just having those check-in questions at the beginning. When we're thinking about our agendas, we also want to think about what goals and projects are we currently working toward. And so maybe having that as a standing agenda item for different updates on those projects. So maybe we're working on updating our protocol. And so every meeting when we check in, we talk about what's the status of the protocol update? What are some of those next steps that we need to do? What are some of the things that we need to think about to get that project moving forward? We could also think about training and education. I know sometimes SARTs will have a space set aside for education within their meeting. So maybe they'll have a presenter come in and talk about the neurobiology of trauma. Maybe they'll have different team members present on their roles and what those roles look like. And we will call that cross training sometimes. So that way the folks on the team know exactly what other folks are doing. We also want to think about how we're making any decisions. So I know Sarah talked a little bit more in depth about decision making, but when we're structuring our meeting, we also might want to set some time aside to talk about the decisions that we're going to need to make. And then I always like to end a meeting with roles and responsibilities. So if we do make decisions, if we're working on a project, I always want to assign action items, right? Who's responsible for carrying this forward so that work actually gets done on this particular project. So how are we thinking about that? So now we're going to do a co-creation interactive activity together. And so we're going to pretend that all 92 of us on this webinar today are creating a SART together. And so this is going to be called the XYZ County Sexual Assault Response Team. So we have a name, and we're going to use the SART Mission Builder worksheet that we talked about to co-create together. So on the sexual assault response team, there's 3 questions. So who are we? What does our SART do? And who benefits from our SART? Right, so we've already answered. I went ahead and did this for us, right? We've already picked a name, so we already know who we are. And so we're gonna work together to come up with what does our SART do and who benefits from our SART. So in order to do this, we're going to go to menti.com and we're going to enter in the code. And Madison's put the code in the chat, and it's also going to be on the screen in just a second. So we're going to go to menti.com, enter the code 11472353, or you can get your phone out and scan the QR code on this screen if that is easier for you. All right, so now that hopefully folks are in, we're going to answer the first question. So what does our SART do? So just go ahead and type what the SART's going to do in the chat, and it's going to populate with all of our various answers. Yeah, so if you missed the QR code, you can go to menti.com and enter the code 11472353. Awesome. I'm seeing lots of answers come in. So I see case review, build service capacity for survivors of sexual violence, provide trauma-informed services, interdisciplinary education, provide resources, teamwork, and partnership on cases involving sexual assault of adults, improve community response to victims and survivors of sexual violence. The SART will collaborate to best help survivors, examine current trends and reports, help provide quality, comprehensive care to victim survivors of sexual trauma, create protocols, cross-training. Yeah, so these are all excellent responses. We're going to decrease barriers. We're going to provide a victim-centered approach to ensure that folks have access to the best care and resources available. Great. Yeah, so if I was in a meeting, if I was facilitating a conversation to build a mission statement, once we have all of these answers in, the next step that I would do is we would all work collaboratively to kind of narrow this list down, right? Because this is quite a lot of different things that our SART could be focusing on. And we might want to narrow it down a little bit so that it's a little bit more cohesive of what we're working on. And so that's going to be that co-creation process where we all work together to really identify what some of those priorities are. So maybe we're going to come out with, we want to provide trauma-informed, victim-centered community response to sexual violence in our county, right? So maybe those are some of the things that we come to agree on after we're all answering this question together. And so then once we've decided collectively on our answer to what does our SART do, we're then going to ask ourselves who benefits from our SART, right? Who is our really specific population that we are working to support? And again, you can go ahead and enter some of your answers in the Mentimeter, and it's going to create like a word bubble for us to see what some of those really common responses might be. Awesome. So I'm seeing survivors is the biggest answer, which is not a surprise. But then we're also seeing community as a pretty big answer, as well as advocates, allied professionals, right? All those different folks who are involved in the sexual assault response in our community. I see marginalized populations in there as well, right? So there's different folks that we want to make sure that we're including in our SART. And this is something that we could also include in our mission statement. So we could say that we're really community driven, that we're survivor centered, right? So different ways that we can bring in some of these pieces of who we want to benefit from our SART when we're crafting our mission statement. So then again, if I was facilitating this meeting, pretending that it's like 91 of us working on this together, we could then go in and identify who are those priorities of our SART. So the ones I'm seeing that are the biggest are community, survivors, and marginalized populations. So maybe we want to decide to focus on those 3 groups when we think about our mission statement. All right, so thanks everyone for participating in this with me. So now that we have kind of brainstormed some of those things, I also want you all to take a shot at brainstorming in the chat some of our potential mission statements. So we could say who we are plus what we do plus who benefits equals our mission statement. So as a reminder, we are the XYZ County SART. So there's no wrong answers. It's just pop some example mission statements that maybe are Mentimeter inspired in the chat. And I'll give you all a little bit of time to think about that, because I know sometimes wordsmithing can get a little bit challenging. You can enter these in the chat. I think the Mentimeter should be closed. So yeah, go ahead and enter them in the chat. So I see one example. We are the XYZ County SART, and we conduct education and case review to improve the response to sexual assault survivors. Great. The XYZ County SART team focuses on providing services and resources to survivors of sexual assault by focusing on collaboration with members of the profession who seek to help those survivors. Wonderful. We are the XYZ County SART that works to increase trauma-informed responses, increase reporting, increase community involvement and services to the area to benefit sexual assault survivors and the community as a whole. Awesome. Yeah, these are great ideas coming into the chat here. So I know I'm kind of doing like a mock facilitation of this co-creation. So again, if we were doing this in real life with our team, we might brainstorm some different statements here for our mission statement, and then again, go ahead and narrow them down, combine them. One technique I like to do is folks come up with their statements, and then people will go around and put like a dot on the ones that they really like, or they might circle different pieces that they really like. And so then we can start to combine different things and mishmash them to come up with a really great and strong statement. So thank you all for coming up with these ideas. They're really, really good. So I'm really excited to see what different mission statements that you all come up with your respective teams.
A really interesting question just came up in the Q&A that I don't know if we have the answer for, but I think is a really good question to ask folks who are on this webinar what they think. How can we incorporate service providers who work with offenders and perpetrators into our mission statements? This might be a tough question that involves some interesting wordsmithing. I'm curious if there are folks out there who have SARTs that do work with offenders, and what that looks like in terms of your mission statement.
So I see folks can't see the question. So I'm not sure if
It's in
folks
the
can
Q-
see it
yeah.
in the Q&A, but I pressed answer live, so I'm hoping y'all can see it. One idea that I have to share is we can talk about community accountability and community safety. And often when we think about accountability and community safety, that is going to incorporate working with perpetrators, right? And so it can be, we can use some of these broad terms as well to incorporate different folks in our work.
There's some great responses coming in the chat. Michael also brought up a lot of forensic nurses provide both victim and offender exams. That is something that happens a lot. So that can be really a useful place to sort of emphasize that overlap. This is great. Thanks, everyone.
I really like someone suggested those impacted by sexual violence.
Yes.
Because perpetrators are impacted by sexual violence, right? Because they're participating in it. And they also could be victims and survivors themselves.
All right. We've got a couple of folks who might have to leave early, so I just want to plug that we are recording this webinar and we will be sharing out the link to that recording in the next few days. So if you aren't able to stay for the whole thing, you can watch it at your leisure. All right, so we're going to move on to some action steps that you can take within our phases of systems change. So for those of you that have seen our SART 101 presentation or have seen SVJI present on systems change in the past, we have a 3-phase system that we use to talk about systems change within SARTs and within communities. Phase 1 is assessing the status quo. Phase 2 is making change. And then phase 3 is measuring the change. So we're not going to get too deep into the definitions of those phases, but we are going to talk about a couple examples of things that you can do during those phases for your team. So again, assessing the status quo. This is where you are figuring out what's going on the ground right now. You're figuring out who are the existing service providers, who do we have in our community, what resources are available, what resources do we need, what does sexual violence look like in our community today. And there are a number of strategies for that. So there's a variety of things you can do. You can inventory those existing services. You can do observations of service providers. You can map your response. There's a lot of different ways that you can try to see what's going on the ground. One of the, I think, most important ways is to talk directly with the folks that you're serving. So talking with victim survivors of sexual violence. What was the process like for you? What's going well? What's not? Where are their needs that you're seeing? And finding out the answers to those questions in a trauma-informed and really constructive way.
So one of the examples that we're going to talk about today is mapping out that existing response, because this can be a way to really understand what is working and what might not be working in your community as a starting point to talk about what we want to do as a team. So there's some different ways to do this. One that I like to do is walking through different scenarios. So instead of like looking at actual cases, we can walk through some different hypothetical scenarios. So something like a survivor walks into the hospital, and then we map out what the response looks like from there. Or the victim calls 911 to report that they've been sexually assaulted, and then we map out the response from there. So we think about some of these different entry points of how a survivor may disclose that they've experienced sexual violence in your community. And I see in the chat, someone's asking, how can we find different hypotheticals to go through? I think that's a great question. And you're gonna wanna think about your community. So where are survivors going after they've experienced a sexual assault? Who are they talking to? Who are they disclosing to first? And so something that you might want to do to find out some of those answers, you could do a community needs assessment to find out some of those answers. You could also talk to each other on the team to see like some anecdotal evidence of what the different responders are hearing through their various roles to kind of see what hypotheticals are going to work for your community. One suggestion I have too is think about the main members of the team and what the response is going to look like for their perspective. So you're going to have law enforcement, you're going to have community-based advocates, you're going to have the forensic examiners, right? And so those three groups are oftentimes different entry points for survivors. So you're definitely going to want to make sure to cover those three groups in your own community's hypotheticals. As we go through the different scenarios, yeah, schools can also be a great example for an entry point of when someone's going to disclose. And so if they're on your team, that can be another great hypothetical to have. Thank you for that. So when we walk through these different scenarios, we're going to want to think about what's the current response. So we're not going to want to think about what's the ideal response. We're going to want to think about what is actually happening right now. And then if it's not what we want to be happening, then we can talk about changing that response. We're going to want to look for different types of gaps. And so two of the gaps that I think about are collaboration gaps and services gaps. Sometimes when we think about gaps, we can get stuck on those services gaps, like there's no services available or we don't have a particular type of service in our community. But for a sexual assault response team, we're actually going to want to focus on collaboration gaps. So how are we working together? What could go wrong if we don't work together in this response? And think about those types of gaps. And then when we do it, we also want to think about what are these strengths in our current response? What are we doing well? As well as thinking about what are some solutions to solve the gaps or the problems that we're identifying. So now we're going to walk together through an example scenario. So this is a completely made up example. It is not based on anyone, any community, but it's just completely made up. So we're going to walk through it together and then talk about it in the chat. So this scenario is a victim or survivor calls 911 after experiencing sexual violence. So we're going to map this out to the end of the initial response. So the next thing that happens is that patrol is dispatched, right? Then patrol arrives to the scene and they screen the victim survivor for a medical forensic exam, right? So they find out if the survivor if they experience a sexual violence within the time limit for their community to receive that exam. So they screen positive. And the patrol drives the victim survivor to the hospital for a medical forensic exam. The patrol also contacts the detective about the same time. So they get to the forensic exam hospital location and the medical forensic examiner performs the exam and then notifies an advocate. Because patrol contacted the detective also arrives at the hospital to speak with the victim survivor. And then finally, the advocate arrives at the hospital to speak with the victim survivor, right? So this is our scenario. So our first question in the chat is, how are the responders collaborating? What is working well with this response and their collaboration? So what do we think? So they each have a role and know how to respond. There's communication of the response. It seems like all the necessary people are being notified in a timely manner. Everyone's notified. However, the victim is having to talk to too many people. Yeah, so for right now, I just want us to focus on what's working well, but not what our criticisms are of the scenario yet. Services exist. Yep, that is definitely a plus. So anything else that is working well, they're all communicating with each other. Yes, I think when I look at this scenario, I think everyone is communicating with each other, and that is definitely a strength, right? So the medical forensic examiners involved, patrols involved, the detectives involved, and the advocate is involved, right? And so this is a really solid foundation to really improve what we want this response to look like. So my next question is, could the responders collaborate differently, or where could this collaboration break down? So what would we change about this for a better collaboration? Yeah, so folks are pointing out that the advocate could be called before the exam. An advocate's not involved unless there's an exam. So patrol and the detective should be contacting the advocate before the exam, or if there's no exam. Yeah, have an advocate dispatched earlier. Have patrol notify the advocate. Absolutely. One person also wants to know how patrol screens the victim survivor. Yeah. Yeah, so these are also very similar to what I was thinking about for this scenario, because I also noticed that the advocate isn't contacted until the medical forensic examiner does it. So what happens when the survivor does not qualify for a forensic exam, right? So maybe they call 911, but it's been 2 years. So they're not going to qualify for a forensic exam. So how then is patrol potentially notifying an advocate? So there's a few different ways I think that this collaboration could break down. So now I want to ask, how is this response victim-centered, and what is working well from that perspective? Or is it victim-centered? What do folks think? Yeah, so patrol has enough knowledge of the specific needs of sexual violence survivors to screen for an exam. Yeah, I think that's a good example of how this is potentially victim-centered. Bringing in an advocate earlier would be more victim-centered. All parties that are involved are participating. Yeah, it is hard to tell if it's victim-centered with the information that we have, because we don't know how the victim's informed and how they have the ability to choose the services. Having transportation to the hospital is helpful. Yeah, exactly. Yeah, so we don't know, we don't have enough information, I think, from this particular scenario to answer all of the questions that you're bringing forward in the chat, but they're really great questions to think about when you're talking about a similar scenario with your team. Yeah, so there's definitely some pieces that are more victim-centered, and then there's also pieces that are probably not victim-centered at all. And I know many of you pointed out the advocate not being dispatched until the hospital and really after the exam is probably not victim-centered, right? So now we want to think about how can this response be more victim-centered? How could we make this general practice more victim-centered? Yeah, so at the very first step, having options other than law enforcement available for initial contact. Yeah, so in one community I worked with, they actually started having their 911 dispatch be able to dispatch advocates as well. So 911 would call the community-based advocacy program so that they could meet the advocate when they called 911 if they didn't want to report right away or different things like that. Yeah, so the victim does call law enforcement in this case. So I think we can assume that they are wanting to have law enforcement involved. Yeah, creating fewer steps or stopping points for the survivor having to retell their story. Yeah, so one of the things that I noticed as well about the scenario is that the patrol is contacting the detective and the detective is arriving right away to speak with the survivor at the hospital. And we know from the neurobiology of trauma and the way that trauma really works in the brain, that might not be the best idea. Sometimes it can be better to wait a couple of sleep cycles before having the detective do an interview when a survivor is reporting, just because of all of the chemicals that flood the brain and the body, sometimes can impact how well the survivor remembers what's happened, and how that interview is going to go, right? So that could be one less step at this point in the process that the survivor would need to go through. Yeah, and I see folks saying, making sure to put asking points in. So like asking if they want an exam and asking if they want an advocate, like going through all those different places where survivors can make choices, because that is really, really important to the response. Yeah, and I know a lot of you said earlier that an advocate could be contacted sooner. And I think that is probably one of the most important ways to make this more victim-centered. So having patrol call the advocate, right? Having the advocate called much sooner than they actually are in this scenario. But what I really like about this scenario is that it shows this team working well together in this current response. And then as a group, we were able to come up with a few different ways to tweak this scenario and to change it. So we know what we're working toward and what we want to do as a team to have a better response. So this could be one activity that you do with your team to kind of figure out what are some of those changes that you want to make. And like I said, we want to be sure to do it with every discipline involved in the sexual assault response team. We don't want to just focus on law enforcement's response or the medical forensic exam response or the advocate response. We want to focus on the response as a group and make sure that we are all working together so that we have a consistent response across the team.
All right, and another really important thing to do when you're assessing your status quo is to learn about your community. And you can do this through a lot of existing data sources. I think a lot of times we make assumptions about the communities that we live and work in based on the folks that we see on a daily basis. So you might make the assumption that the folks you're serving reflect your community, but that might not be the case, right? If there are issues going on in your community or with the response that are affecting whether or not victim survivors are seeking services, might give you a really different picture of what's going on the ground. So there's a number of places you can go for data. Things like the census data is really helpful in just gaining some demographic information. What does the population of your community look like? What are some of the age, socioeconomic, racial backgrounds? What are, do you have rural and less rural areas in your community? And are you working with victim survivors from all of those areas? The National Intimate Partner and Sexual Violence Survey is another great data source. Community health needs assessments are another really important source that I think a lot of folks don't know about. Agency and program data, so finding out who it is that you're serving, and then comparing that data to what you're seeing in demographics, in reports of crime, all of those types of things. If your state happens to collect statistics on sexual violence, that's another place to look. You really, really want to listen to community members and victim survivors. You want to make sure that you are hearing from them what they're seeing, what their impressions are, what the perception is about the services provided, the response that's available. And you want to ask a lot of really thoughtful questions. You want to ask, where do people go for help after experiencing sexual violence? So I think sometimes, depending on the discipline that we work in, we can make an assumption that folks go to law enforcement, or they go to an advocate, or they go to a hospital. And we might not be thinking about the local faith community, or the local support group, or some other sort of community support that exists, or community program, or community organization, or loose gathering of folks in a community that work together, right? So what are some of those points of disclosure that you might not have thought of? What do people in your community know about sexual violence? So are folks aware of problems that exist? What does that knowledge look like? Are folks informed on the types of sexual violence that occur and different, prevention opportunities? And then also asking folks what is needed to improve the response. I think often, folks who don't do this work might not understand the intricacies of certain parts of our jobs, but they can tell us broadly what is working and what's not, in a way that we can't always, because we're in the middle of it. So it's up to them to tell us what needs to get better, and up to us to figure out how to do that. We have so SBGI does have a resource for evaluation, and I'll talk about in a minute, that does include some community assessment tools and questions, including mock interview questions, and sample focus groups and things like that. So if you're wanting to get that information, we do have some resources available for you to get started on that. Okay. Phase 2 of systems change is making the change. So again, really briefly, that means we're developing or revising our interagency protocols. So we're figuring out how to work together. We are identifying our needs. So what kind of training do folks need? What are some of the knowledge gaps or skills gaps that our team can address? And then creating some programs or tools or resources to fill those needs. So that strategy can look a lot of different ways, but it's really broad. It can be changes to individual practices. So individual person, each advocate, each police officer, every responder, changes to agency policies. So all law enforcement, all, healthcare, cross-training with team agencies so that folks are better understanding each other's roles and how they can fit together. This can really be extremely valuable. Kind of like I touched on earlier, better understanding each other's jobs helps you do your job better. It also helps you figure out how to make each other's jobs easier. There might be parts of my job that I do thinking that I'm helping you, when in fact, it would be better for you if I did it a different way. And having those conversations can really help streamline a lot of the work that you do. It's also a place where you want to think about who is on your team, who is missing. When you've been talking about those different points of disclosure, are there any folks that then should be part of your SART? Are there places that are heavily represented as places that victim survivors go for help that you need to include?
So one of the examples of making the change that we wanted to go a little bit more in depth on is protocols. And as a heads up, we are going to be doing a more in-depth protocol webinar in June. The registration isn't out yet, but please stay tuned to our email list so that you can join that training. But when we talk about protocols, we're really talking about how the team is going to work together and how we can improve our overall response together. And we're developing some policies and procedures to guide that response. The protocol is going to be multidisciplinary. So ideally, it's going to include all the different professions that are on your team. And it may have like a section for each profession, what that response looks like, and then also ways that you can collaborate together. One thing that's really nice about protocols is it defines all the different roles, which is really, really helpful for understanding our unique roles and how we respond. So one of the sources of conflict that we see among teams is often based in a lack of understanding of what the other responders are supposed to be doing and what their values are in their response. Right. And that's always going to be a challenge when we're working on a multidisciplinary team of any sort. But having this understanding of each other's roles can be really helpful for that. Protocols can help increase collaboration and consistency because maybe we have one detective who's really, really good at their job, and then there's another detective who is maybe less interested in sexual violence. And so how can we create a protocol so that both detectives are responding in the same way to survivors? So it's not chance as to whether or not one gets one who's really passionate about sexual violence and one who's maybe not as interested, right? And the same for any other profession, right? We all know that there's different champions and people who are really interested in the sexual violence response for their agency, but how can we get that agency to respond in a consistent way to everyone? And then, of course, we want the protocol to be a living document. So the protocol is something that we should be continuously trying to improve. We want to update it. We want to revisit it maybe every few years to make sure we're doing what we say we're doing and we're responding the way that we think we're responding, right? Because sometimes we can write it down, put it in this protocol. We've accomplished this great undertaking. But then if we're not actually implementing it, we need to double check on that, right? We want to make sure that we're implementing it, we're doing what we're saying. So when we are updating our protocol, there's a few considerations that we want to look at. So is this a new protocol or are we updating an existing protocol? This is going to determine how we want to go about working on the protocol. We also might want to think about timelines. So it's not uncommon for a protocol to take a year to work on, right? So we want to make sure we are giving ourselves enough time to work on something like a protocol. We also want to think about who's going to be responsible for what. So is there going to be one person leading the process? Who's doing the writing? How is the whole team going to be involved in this process? So we want to brainstorm a little bit about what works best for our team. We also want to think about how we're including survivor voices in the protocol update, right? So doing a community assessment, like Sarah was talking about, can be one of the ways that we make sure we include survivor voices in this response. Maybe doing some program evaluation with survivors to figure out if that response is actually working the way we think it's working for survivors. And all of this really is to make it victim-centered, right? We want our protocols to be as victim-centered as possible because that is one of the foundational purposes of a sexual assault response team. We want to come up with different ways of working on the protocol. So some of the ways that I've seen teams do is they'll have a subcommittee, and it's that subcommittee's responsibility to create the protocol. Sometimes I've worked with teams that will break into discipline-specific groups, and those groups will then write their portion of the protocol after doing a group-wide activity like the mapping activity to figure out what we're changing, what we're updating. Some SARTs, especially smaller ones, will do it as a full group. Maybe it's a standing agenda item and they work on it a little bit at a time at each meeting. I've also seen folks start with an existing document, or maybe they start from scratch. So there are a few different ways to start with an existing document. So depending on what state you live in, your state might already have some guidelines for sexual assault response teams. And so in one state I've worked with, we would use those guidelines at like the statewide guidelines as a base for our protocol because it already had all of the state laws that were applicable to the sexual assault response teams. And then we were able to tailor that document to the community. We also have a protocol template on our website. And so that can be a base to start your document, your protocol on. But then of course you can always start from scratch as well. It's just going to depend what works best for your team and for your community. And then if you're in a state and you're not sure if there is a statewide guidelines, I would recommend reaching out to your state sexual violence coalition because they're probably going to know if there are such guidelines in your community, and they're also going to know the applicable laws for your state. And the last consideration we want to think about is the implementation of the protocol. So once your protocol is finished, how are you going to implement it? How are you going to train the other responders, right? How is all of patrol going to be trained? How are all the forensic examiners going to be trained on this response in your community? How are all the hospitals included or the schools that are included, right? So we want to think about how we are getting it out after we finished it so that we make sure that we follow the protocol.
All right, so then phase 3 of our systems change model is measuring the change. Next slide. So for measuring the change, that is the place where we are monitoring the implementation. So we're making sure that we are doing what we said we would do, assessing those gaps and barriers that might still exist or new gaps that might have been created. If there are any unintended consequences of the changes that we've made. This can include surveys and focus groups. It can also include things like case file review. So there's a variety of strategies to measure all of these areas. And I think what they really kind of come down to is evaluation. So we're going to talk a little bit about evaluation. And we've got a quick Zoom poll for folks.
All right, it looks like a good chunk of you have responded, so I'm going to go ahead and end the poll. And you should be able to see the results. So the number one answer, 54% of you said that you are somewhat comfortable with evaluation. And then a good chunk of you, 15%, said you're very comfortable with evaluation. So that's pretty exciting. And then a few of you also said that you were unsure or somewhat uncomfortable with evaluation.
All right. Next slide, please. All right, so we're just going to talk a little bit about evaluation as a concept. We're not really going to get into specific strategies on evaluation other than what we've kind of talked about so far, but we do have a lot of resources available and staff who are always really excited to help, particularly, again, another shout out to Madison, our tech support person, who is also our in-house evaluation wizard. She's amazing and loves to talk about evaluation at all times, whenever possible. So she's the person we go to for our in-house evaluation. So first off, what is it? What are we talking about? Evaluation is the process of gathering information. And you're gathering information in a bunch of different ways. You're listening to people, you are reading documents, you are asking questions, you are observing, you are doing all of that, you're learning from that data, and then you're reflecting on it and making changes based on what you've learned. It's really important when you're doing evaluation to come up with a plan ahead of time, know what approach you're going to use, know what methods you're going to use before you begin evaluation. And then also making your judgments from established criteria. So you really want to be thinking about your process before you start. And that can really affect how your evaluation comes out and whether or not you're getting really accurate information and whether or not you're getting the whole picture. Evaluation really provides that evidence for decision-making. So you want to make sure that you've got all of the evidence and that you're not accidentally skewing that evidence with, you know, if you hear something during an interview that causes you to go on a whole other tangent with your evaluation, that's maybe a little less useful than other options would have been. So just making sure that you're really thinking about the process. It's not a place where winging it is a great idea, which is rough for me because I'm a big fan of spontaneity. All right, next slide. So why is evaluation important? It really, I mean, what it really boils down to is if you want to do your job well, you need to know how you're doing, right? You can't be good at something if you're not getting feedback on it, if you're not finding out what areas that you're making mistakes in. So it helps you determine those areas of strength and also what your limitations are. Where are the things that we're doing really well? What can we highlight? What can we build on? What can we kind of pat ourselves on the back for? And also, where are some of the areas that we still have work to do? What are some of the things that aren't going as well for us that we need to spend some time on? It's really important to examine our own practices. And this is true across disciplines. What are the things that we're doing day to day? Not only what do we say we're doing and why are we doing them, but also what are people actually doing on the ground? Are all folks in a discipline kind of reading and interpreting those policies or protocols the same way? And how does that look? So when we were doing the mapping exercise earlier and folks were talking about, it's not necessarily what the map of the response looks like, but how those steps are done. So how are the detectives and the patrol officers and the SANE nurse, how are they talking to victim survivors, right? Are they using victim-centered language? What does that look like? Is everybody, on the same page with how to actually execute the response? It also helps you investigate the effects. So what happens after? You might know what your response looked like. You might know in the minute what you learned from it, but what is the impact that has long-term? Was there, a victim survivor who, for a few months after their interview was still really upset about the way that their interview went. Is there something that can be done about that? How did somebody's experience somewhere in the process affect their willingness to continue with the process? And then it also really helps to demonstrate the impact of the response. And that can be in a couple different areas. I think one of the really well-known and kind of frequently talked about areas is the criminal legal response, right? We've got law enforcement, we've got prosecution. So when we talk about measuring effectiveness, we're thinking about how many folks are getting arrested, how many cases are getting prosecuted, how many convictions are we getting. But also, it's really important to understand that there's a variety of areas of the response that aren't about the criminal legal system that are as impactful, if not more impactful, to the victim survivor. So really understanding, like, how was my medical forensic exam experience and how did it affect my life as a victim survivor, right? What kind of gains are we making? Are we doing better and now we've got increased reporting or increased folks seeking services? Do we have more folks who are reaching out for supports in community organizations? We all know that increased reporting and increased disclosure doesn't actually mean that there's increased violence, right? It means there's increased talking about the violence that already exists. So whether you're hearing that, for law enforcement or whether you're hearing it from those community points of disclosure, the more you're hearing, the more you know that something is going right and people are starting to trust different entities in your communities. Victoria, we're going to say something?
Nope.
Oh, you unmuted. All right.
All right, so we're almost to the end, but we've laid quite a few different pieces that are really important for a SART's foundation. And once the foundation is really established, we also want to talk about sustaining your team. So something that can happen is sometimes you're working with your team and you get stuck. You're not sure what to do next. And so we really encourage you to take a look at our systems change wheel. So assess the status quo, make the change, and measure the change to identify new projects and goals for your team. And you can come up with a variety of different things looking at that wheel. And when you come up with your goals, we also recommend developing what we call SMARTY goals. So strategic, measurable, ambitious, realistic, time-bound, inclusive, and equitable goals. Right, so what does this look like? So strategic means it's reflecting an important dimension of what your organization or your team seeks to accomplish. Right, so what is that overall strategy you're working toward? Measurable. Measurable is those standards for how you can measure this to see if you've accomplished that goal, right? So maybe it's like you want to add 3 new members to your team. And so then once you've added 3 new members to that team, you know that you've met that goal. We also want goals to be ambitious. So challenging enough that achievement would mean significant progress, right? It's going to be a challenge for your team to do, and it's not going to be an easy business as usual kind of goal. But we also want it to be realistic. So it's not as challenging that it wouldn't be possible to do, right? So we want to make sure we have the resources and capacity and the ability to execute the goal so that it's realistic. Having a time-bound goal means that it has a clear deadline. When your goal is inclusive, you're focused on bringing traditionally marginalized folks, especially those who are most impacted by sexual violence, into the process and the decision making and in ways that share power. And then an equitable goal is going to seek to address systemic injustice, inequity, and oppression. So an example goal is our SART will conduct a community needs assessment over the next 6 months to find out if the team is currently meeting the needs of victim survivors and community members with a particular focus on underserved victim survivors in our jurisdiction. right? So this could be an example goal of something that you want to work on next. So with that, I want to check in to see if folks have any questions. Feel free to pop questions in the Q&A or in the chat, and we will answer them.
We're also going to post in the chat a link to our evaluation. So if you would be so kind as to fill that out and let us know how we did and how we can improve these webinars that we're providing you folks. We'll be sending out a link to the recording sometime, I think, by the end of this week for folks who might have missed it, or if you want to watch it again. And please feel free to get a hold of us with any questions or follow-ups that you might have.
And if you'd like to email Sarah or I, you can contact us at svji@mincasa.org. So that's on the screen now, as well as our website. I know the website link was popped in the chat as well, but we have lots of resources. And so feel free to reach out to us if you have any questions or if you want support on anything with your team. Madison, could you repost the evaluation link? I'm seeing some folks are missing it in the chat.
Thanks so much, everybody. Go ahead, Victoria. Sorry, I cut you off.
I was just going to say, I'm not seeing any questions come through. So I think we can go ahead and end the webinar today. Thanks everyone for attending. We hope to see you all at the protocol webinar coming up soon.